Alright, so for this video we're going to do abdominal pelvic structures. We'll start with just orientation here. You're looking at the diaphragm. And so as we move inferiorly, major organs, we have lobes of the liver, gallbladder, stomach, duodenum. Running along the duodenum is this glandular structure here. This is the pancreas. And you can see mesentery extending between the digestive structures. The larger fatty mesentery that you see here coming off the greater curvature of the stomach would be the greater omentum. So this is the greater omentum. Going from the lesser curvature to the liver, this would be the lesser omentum. Right here we see the spleen. The duodenum continues as the remainder of the small intestine. So the second section would be the jejunum, and then it would eventually end as the ileum of the small intestine. And the ileum connects to the large intestine. This is large intestine. And it's connecting at the cecum. So this is the cecum of the large intestine. And so we have the ileocecal junction. And then the large intestine continues down this way and eventually becomes the rectum. So the rectum's down here. And then the anal opening would be back here. As we pull the organs to the side here, we can see behind the peritoneal structure, so behind the mesentery, we have the kidney, so a retroperitoneal structure. And the kidney has a tube. So if we look right here, you can see the tube running in this tissue. This is the ureter, so it's coming down from the kidney. And that ureter is plugging into the urinary bladder. And so we can see that there's actually two of them. So here's the other ureter that'd be coming from the other kidney. So ureter here, and ureter here, urinary bladder. And then emptying the urinary bladder would be the urethra. So we see that single urethra. Looking at abdominal vessels, we can see passing through the diaphragm. We have the large aorta. So this is the descending abdominal aorta. The first major branch coming off the abdominal aorta is the celiac artery. Next major branch is the superior mesenteric artery. Next major branch would be the renal artery, so heading into the kidney. As we move farther down the abdominal aorta, we get to another major branch. This would be the inferior mesenteric artery. And then we get to the branch point here where we can see the common iliac arteries. And then we would have internal iliac arteries and external iliac arteries, and the externals would feed in as the femoral arteries. If we look at the venous system, what you're looking at here is the inferior vena cava. Major branch point here. Okay, so we have the renal vein, so draining the kidney and coming into the inferior vena cava, so renal vein. This vein right here is a gonadal vein. And then if we follow that inferior vena cava, we can see down here we have the common iliac veins. And if we look deeper, you'll notice an internal iliac vein and an external iliac vein. So once again, there's the internal one and the external one. And if you follow the external, that would be a femoral vein in the leg. This is a male cat, so right here we can see this little tube. You can see it coming around this way. Okay. So that is a vas deferens. You can also see it on the other side. Here's the other vas deferens. And those are coming from the testes. So here we have the scrotum of the male cat. And so if we were to look actually inside the scrotum, you could dissect this out and actually find the testis inside there.